If you have spondylolisthesis, you may have back or leg pain when standing or walking for long periods of time or when lifting heavy things. Spondylolisthesis, or a slipping of one vertebrae on another, can cause some major issues, but it doesn't have to. Hi, I'm Dr. Dave Candy, and in this video, I'll explain exercises to help relieve pain from spondylolisthesis. Now, before we get started with exercises, there are actually two different types of spondylolisthesis. To understand that, we need to clarify some terminology. Because if you see the word spondylolisthesis on an MRI report, there are some other words that sound kind of similar. Spondylosis is a word that means an abnormal condition of the spine. Basically, it's a synonym for arthritis or degeneration in the spine. Spondylolysis means a fracture of a part of the vertebrae called the pars interarticularis. And when that pars interarticularis fractures, sometimes it can cause one vertebrae to slip on another one. That slipping of one vertebrae on another one due to a fracture is called isthmic spondylolisthesis or spondylitic spondylolisthesis. So it's a slipping of the vertebrae due to a spondylolysis. Now, the other type of spondylolisthesis, which is actually more common, is a degenerative spondylolisthesis. This happens as you age and you lose water content in your discs. Your discs normally have a gelatinous inside called the nucleus pulposus, which pushes outwards on a hard outside called the annulus fibrosus. When those discs are well hydrated, it makes a firm stabilizer, which is really strong and holds your spine in place. However, when the discs dry out, they no longer exert outward pressure against the walls of the annulus, giving it some laxity or some increased slippage. That can cause one vertebrae to slide forwards on the other one. Now, the first type of spondylolisthesis, the type that's caused by a fracture in the lower back, usually starts to develop in childhood to adolescence. It's more common in males than females, and particularly people who participate in sports like football, wrestling, or weightlifting. And because males tend to participate in those activities more than females, it's about twice as common. However, it can also happen in cheerleaders or gymnasts or people who do a lot of backward bending type of activities. Now, the other type of spondylolisthesis, the degenerative spondylolisthesis, develops more in middle age to older age as you lose water content in the discs. And that type is actually about 3 times more common in women. Now, the severity of spondylolisthesis is graded on a 1 to 5 scale. Grade 1 is less than 25% slippage. Grade 2 is 26 to 50% slippage. Grade 3 is 51 to 75% slippage. And grade 4 is greater than 75% slippage, with grade 5 being the upper vertebrae has slid all the way off the lower vertebrae. Now, the good news is that in most cases, you don't need surgery for a spondylolisthesis, and the presence or absence of a spondylolisthesis is not highly correlated with people who do or don't have back pain. Now, the decision as to whether or not you'll need surgery for a spondylolisthesis is usually based more off of your symptoms as well as your response to conservative treatment, more so than the severity of the spondylolisthesis. There is an exception that in children or adolescents who are skeletally immature, meaning their growth plates haven't fused yet, a slippage of more than 50% is usually an automatic indication for surgery. Now, you might wonder, how can exercises help a spondylolisthesis if it's due to degeneration of a disc or a fracture of a vertebrae? And the answer is it doesn't fix the anatomical problem, but it can help resolve symptoms. And again, the decision as to whether or not you'll need surgery is based more off of your symptoms and function than it is off of the anatomy. The degree to which the upper vertebrae slips forward on the lower vertebrae is due to the balance of forces pulling the vertebrae forward versus the balance of forces pulling the vertebrae backwards. If you have a large tippage of your pelvis forwards, that makes a downward angle, and the force of gravity slides the vertebrae forwards. Furthermore, you have muscles, particularly your hip flexors, that pull the vertebrae forwards. And then you have other muscles in the back of your spine, particularly ones known as the multifidus, that pull your spine backwards. So we'll go over 3 different categories of exercises, one to help with the forward inclination angle, one to help with the hip flexors, and one to help with the backward forces to increase the strength of the muscles that pull the vertebrae backwards. Now, overall, if you stand with a lot of arch in your lower back, no matter how strong your back muscles are, it's very likely that that vertebrae is going to shoot down forwards. And the more weight or compression that you're carrying, or the more weight or compression that you lift, the greater that gravitational compression becomes. So fixing posture is a huge component of resolving symptoms from spondylolisthesis. And that starts by just decreasing the forward tilt of the pelvis. You want to think about rolling your pelvis underneath of you so that you decrease that forward sliding angle and flatten your lower back out. The more arch you have like that, the more it's going to tend to squirt that vertebrae out forwards and increase symptoms from spondylolisthesis. The less arch you have in the lower back and the flatter the top of the pelvis is, the less impact that gravitational force has to slide the vertebrae forwards. So again, roll your pelvis underneath. Squeezing or tightening your glute muscles also helps with that. And you can do this as an exercise, but largely learning to do this throughout the course of your day, particularly when you're standing or when you're walking or in upright positions where your back tends to be more arched, is more important. Because if you do 10 repetitions of exercise, or exercise for 10 or 15 minutes, or even if you exercise for an hour, what you do the rest of the day has a much greater impact on your symptoms. So make it a habit of rolling your pelvis underneath, tightening your glutes slightly, and getting your lower back slightly more flat. And that will largely help decrease the impact of symptoms of spondylolisthesis. Now, the second category of exercises is decreasing the pull of the muscles that pull your vertebrae forwards. And that's largely one of your hip flexor muscles known as the psoas. It attaches to the front end of the vertebral body. And so when that psoas is stiff, it pulls the vertebrae forwards. So stretching your psoas is a good idea, but if you're stretching your psoas, you're actually putting that muscle under tension. And so that can actually create a forward pulling of the vertebrae while you're stretching. You can minimize that by rolling your pelvis underneath of you, trying to flatten your back, and then pushing your pelvis forward, avoiding arching like that. So this back leg is the one that I'm stretching in this position. To see it from the other angle, this one will be the one that's getting stretched. You want to roll the pelvis underneath and then stretch forwards like that. If you can't kneel or can't get down on the floor, you can also do a similar version of that, rolling the pelvis underneath, pushing the hips forward with a flat back. Now, it may also be helpful to do some soft tissue work to your psoas before stretching. Again, if your psoas is tight and you try to put it on tension to stretch it, you can pull the vertebrae forwards. So putting a gentle pressure in your abdomen, just to the side of your abdominal muscles, can help release the psoas. Additionally, if you move a little deeper towards the inside, you can actually get towards the vertebrae that's slipping forwards, and it often feels pretty good to put just a very gentle pressure on this. Be careful if you do have intestinal problems or other abdominal issues. Another tool that you can use is called the psoas release tool. You can put this inside your hip bones and then just press down gently using the handles like this. You can also lay on your belly with this, but if you have a spondylolisthesis, I would recommend using it on your back where you have your knees bent up like I currently do. This flattens your lower back out against the table or against the bed if you're using it on the bed. And then you put a gentle pressure using the tool to help release the psoas before you go to stretch it. Now, finally, we want to talk about increasing the strength of the muscles that pull the vertebrae backwards. I put this category last because your psoas is a much larger muscle group than your multifidus. They're actually really tiny muscles that span 1, 2, or 3 segments of your spine. So they're not particularly large and they can't necessarily overcome the entire impact of your hip flexors and the gravitational force. So while strengthening your multifidus is a good thing to do, those first 2 categories are definitely the ones you want to focus on. Furthermore, if you have a spondylolytic or isthmic spondylolisthesis, because the spinous process has fractured off of the front end of the vertebral body, using the multifidus isn't going to be quite as effective for that type of spondylolisthesis. But here's how you strengthen your multifidus. Your multifidus is both an extensor and a rotator of your spine, but it doesn't really have a large enough lever arm to produce any significant movement force, so it's more used for stabilization. One of the most commonly performed multifidus strengthening exercises is the bird dog, where you're on all fours like this, and then you raise one leg behind you and the opposite arm out in front of you. Now, a common mistake with the bird dog is going into too much extension like this, which obviously, if you're trying to decrease the extension in your spine, is probably not a good thing. So you want to make sure to first find a spinal neutral position where your lower back is relatively flat, and then extend your hip backwards, but only to the extent that you don't arch your lower back. So that may be a very small amount of hip extension. Now notice with this that you're also putting your hip flexors on tension. So this is a little bit of an active hip flexor stretch as well. So just extend as far as you can without arching your lower back, and then raise the opposite arm out in front of you. Then come back down, transition to the other side. Leg first, only as high as you can without arching your lower back. And then bring the arm up like that. Now, if you can't get down on the ground or don't want to get down on the ground because it's inconvenient or it bothers your knees or whatever other reason you have, there is a standing version of this that you can do as well. I'm going to show it without holding on to something, but you may need to hold on to something if you have balance problems. So what you'll do is stand on one leg, lean forward slightly like that, and then raise your leg out behind you. Then you'll raise the opposite arm out in front of you, and then come back down. Raise one leg out behind you, raise the opposite arm out in front of you. Now you can do this at varying flexion angles. It's easiest when you're relatively upright with just a little bit of forward angulation of your trunk. The more forwards like that you go, the harder the balance aspect becomes. And additionally, you're getting a little bit of downward translation of the vertebrae. So start, if you're going to do the standing one, in a relatively upright position, just slight forward trunk lean like that. And then you can progress down to more of a horizontal position as your strength and balance improve. So those were exercises to help relieve pain if you do have a spondylolisthesis in your lower back. Again, keep in mind that it's very likely that you may not need surgery unless you're having severe pain, neurological deficits, or you've tried conservative treatment and it's failed. Now, if you are in the St. Louis area and you need conservative treatment for back pain, we'd be happy to help you out here at More for Life. And if you're watching this from somewhere else, we've got another playlist of back pain relief tips over here. But before you go check that out, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.